More than 2 in 5 U.S. adults have obesity, which has long been known to be a risk factor of heart disease and other health issues like high blood pressure and diabetes. But recent research and new medications are changing the way obesity is treated and understood. With me today are Dr. James O'Keefe and Dr. Andrew Sauer with St. Luke's Mid-America Heart Institute. Thank you both for joining us during Heart Month in February. We appreciate it. Dr. Sauer, I want to start with you. How has the medical community's understanding of obesity changed in recent years?
It's really been a revolution, and I think that the Lancet Commission report, which just came out here in 2025, has put a lot of important and relevant attention on obesity as a framework in terms of how we change our position toward treating it and diagnosing it. So, for example, recognizing that BMI might be a bit too crude of a measurement, and there may be other ways to identify obesity, as well as teasing out preclinical versus clinical obesity, which I think is really an important distinction as we think about sort of primary versus secondary prevention, meaning treating disease in addition to obesity, as well as treating the disease of obesity itself.
And staying on that topic, Dr. O'Keefe, can you explain what preclinical versus clinical obesity means and how it can impact a person's heart and overall health?
Yeah, this is a recent change in the guidelines, and we just talk about overweight being a BMI of 25 to 30 and obese above 30. But it's more nuanced than that. And we talk about preclinical obesity, typically between 25 and 30, but also having comorbid conditions like diabetes or high blood pressure, sleep apnea, fatty liver. And these are really common conditions. And even if your BMI is in that sort of mildly increased range, we are aggressively treating those people now. Whereas clinical obesity is BMI above 30 and usually have also, have some of these comorbid conditions.
Dr. Sauer, we've heard a lot about GLP-1s. It's a newer class of medications used to treat type 2 diabetes and obesity, and that's been over the past couple years. How have these new treatments changed the game?
Yeah, so you've heard about these medicines, Ozempic, Mounjaro, Zepbound. They're kind of conceived as weight loss therapies, but in truth, what we use them for is much more than just focused on weight loss. So traditionally, we've been focusing on treating comorbid conditions of obesity, say hypertension, diabetes, liver disease, chronic kidney disease. But with the clinical trials that have gone forward with these GLP-1s and similar medicines, we've been able to see reversal of not just the obesity itself and reducing the fat deposition and weight loss, but we've also been able to see reduction in sleep apnea, heart disease, stroke, chronic kidney disease, chronic liver disease, even addiction. And we've seen a reduction in desire for alcoholics, for example, to consume alcohol, folks struggling with drug addiction, having less relapses. So it's really remarkable what's happening with this pharmacologic space.
This question is for both of you. We'll start with you, Dr. O'Keefe. Can you tell us about St. Luke's unique approach to treating preclinical and clinical obesity with the Charles and Barbara Dubach Cardio Health and Wellness Center and the Michael and Marlis Haverty Cardiometabolic Center of Excellence?
Yeah, these are prevention centers based here at St. Luke's that have been generously funded by philanthropic donations, which have really allowed us to build programs that are unique and best in class. And we're focused on using both a holistic approach of diet and exercise and stress reduction, but also these state-of-the-art medications. And we follow them closely. We develop relationships. Prevention is so effective these days. And with these new tools, I mean, it really, really allows us to markedly change for the better the prognosis of people.
Dr. Sauer?
Well, I think that the other thing to point out is that traditionally there's been a bit of a stigma attached to patients and people who struggle with weight and obesity. Obviously labels, but also assumptions that these are patients who, are not doing healthy behavioral adjustments. But in reality, as Dr. O'Keefe and I can attest, many of these patients have tried lots of different ways to lose weight. Some of them safe, some of them maybe not so safe. And what the therapies are teaching us is that ultimately a lot of these patients have a metabolic set point, kind of a thermostat, if you will, that their body fights to protect a certain increased weight. And these medicines allow us to sort of reset that thermostat and really allows them to unlock the mechanisms that are already kind of primed in our bodies to actually help lose the weight. So, and reverse the disease. So it's a really exciting opportunity to change how we approach obesity.
Is there anything else you'd like to add or a final message for those watching? Dr. O'Keefe, we'll start with you.
Well, prevention and wellness in general have been sort of the personal and professional passions of my life. And so it's really exciting to me because with these new tools, they allow us to, like the bane of our existence in America in the last couple decades have been obesity and its comorbidities, and along with substance abuse. After life expectancy rising all through the 20th century, the first decade of the 21st century, starting about 2014, life expectancy started falling in America because of these two things. We didn't have tools before. Now we have tools, remarkably effective tools that will not only get the weight down by changing the reward pathway in the brain so you're not craving all this junk food all the time, but also sort of miraculously will cut back on addictive cravings for whatever your particular, weakness is, whether it's junk food or alcohol or opioids or, compulsive gambling.
Sure.
It's pretty amazing, these tools.
Dr. Sauer, any final thoughts?
The only thing to add, I think, is just that this is just the beginning of this revolution, and we're really proud of the fact that our folks here are leading the science and the innovation to get from beyond these first-generation therapies to really what's going to be a second and third generation that's already in the pipeline, and we're ultimately leading these world-class clinical trials. And so stay tuned. I hope patients can pay attention to what's going on here and how we can help.
And we can thank you both for your work, and we'll be staying tuned for all of that. Thank you both for joining us during Heart Month. We really appreciate it. To learn more about the Cardio Health and Wellness Center, visit stlukeskc.org/cardiowellness. And to learn more about the Cardiometabolic Center of Excellence, visit stlukeskc.org/cardiometabolic. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.